Thank you all for joining us for this very exciting panel. I want to especially thank the incredible leading women leaning in and discussing an important topic, the best of both worlds, corporate leadership meets corporate responsibility. Thank you to the Rosalind Franklin Society for hosting this event and for the impactful platform that you have gifted to our industry for recognizing women and minorities in science. My name is Cassandra Wesselman. I'm Head of Clinical Solutions and Patient Empowerment at OnRamp Bio, and I will be moderating this panel today. So now with me are three women on this panel that I feel so appreciative to be at the table with. Nicole Boyce, CEO and founder of RareX, Elena Wetherill, Director of Alliance Management, Business Development, and Licensing of Novartis, and Susan Tusi, Chief Product Officer of Illumina. In a moment, I would love to have these incredible women introduce themselves. And before I do that, I thought it'd be a good idea to briefly set up this discussion topic of responsibility and how leadership across any type of organization, nonprofit, for-profit, academic, how we have the real potential of recognizing more women and minorities in our industry to bring more of these voices front and center. So Rita Colwell, the president of the Rosalind Franklin Society, has an amazing book that just came out called A Lab of One's Own. If you haven't purchased it yet, please do so. It's incredible. And inside this book is an example of the American Society of Microbiology. Now, this society had an interesting challenge where they noticed that the committee responsible for assigning and inviting speakers to their annual events, well, a third of that committee were only inviting men. And two people noticed this discrepancy, this issue. Arturo Casadevall and Joe Hendelson came forth and said, we need to change this. We need to make a difference here because these meetings are predominantly men in these conversations. So they went to the committee and they proposed this issue and they said, we have to change this. Well, the first year, nothing happened. The second year, they got personal and they started going one by one to each of the committee members and said, you really need to consider inviting more women to these panels. We need to get more broad voices into the conversation. And by the second year of making this a very clear action item, 100 women were then speakers at their events. 48% or more of the speakers at these events were women. So while it does take quite a bit of effort to move the needle, it doesn't really need to take that much time, as we can see with this example. So for this conversation, we would love to hear from our amazing panelists and give a brief introduction of yourself. So first, I would love, Nicole, if you could take a moment to introduce yourself. I'm just so inspired by you and looking at your org chart at both Global Genes and at RareX, I see 80% of your leadership being women. And so if you could take a moment and just share a bit about your background and how you got to be where you are, I think it would be really inspiring for others to hear that story.
Sure. So thank you so much. And Cassandra, honored to be here, and especially with this amazing piano. So again, Nicole Boyce, CEO of RareX, but previously CEO and founder of an organization called Global Genes. We are rooted in patient advocacy and focused in rare disease and in supporting the community. Prior to this, I came from the venture capital world. And I'm sure you can imagine it was primarily, 80% men. And ironically, moving into this world of rare disease, and in particular, our organizations, not only our organization, the people that we work with, but even the community that we're serving was 80 to 85% were really focused on women and families and those that are leading families or leading intending to lead efforts in rare disease on the patient advocacy side. So I would say that by default, I moved into a world that was supporting a community that was made up of many more women kind of leading efforts or needing to lead efforts. And our organizations then were kind of mapped to support those that we were serving at the time. And then today, I mean, I know that we'll be talking about this later in the discussion, but in addition to women, I think we're also going to be talking about kind of serving the broad spectrum or the underserved, or ensuring that we have diversity, equality, and inclusion in everything that we're doing. And, this has become something that's very important in the world of advocacy, but advocates moving into these roles of having to become experts in advocacy, development of organizations, having to become science experts, having to become, experts in working with both industry, academic research, government, etc. And so what I'll be talking about later is how we as an organization are committed to supporting women and diverse populations to be equipped to sit at the table and lead and participate in this world of biotech and the life sciences. So I'm honored to be here.
Thank you so much. And we're honored to have you here and learning from your ways of doing what you've done and making the differences you've made for patient advocacy as well as within the biotech world. So thank you for that. Elena, I wanted to go over to you next. Elena, thank you so much for being here. Your work regionally in Boston really inspired me, and your work with empowering more women in STEM with West, and as well as with Novartis, and really being that alliance manager and breaking down those walls and making a big difference in the lives of patients and the finding of cures for the world. Would love to hear your story and just a quick introduction and brief background, if you could.
Oh, absolutely. Yeah. Well, thanks so much again, Cassandra and Rosalind Franklin Society. I think this is such an honor, such a true honor to be on this panel. So I'm currently a director of Alliance Management team at Business Development Group in Novartis. And Novartis, we are structured as such that we have an innovation engine based in Cambridge, and that is the Novartis Institutes for Biomedical Research, or NIBR, as we call it. So, and the NIBR is really the innovation engine of Novartis, and that is where truly the very early discovery begins. In my group, the goal is to break the boundaries, organizational boundaries and scientific boundaries, to bring external innovation and external expertise to Novartis, to build on our expertise and to bring life-saving medicines to the patient. And so over the course of about 10 years now, I have been working in the drug development industry, and I've always been fascinated by medicine and sciences, which I can tell you a little bit more about my background. And drug development, it's truly team sport or team business, right? So there's really not one person or even two people or even 10 people that bring medicine to the patient. It's a diverse team. It's truly a diverse team of biologists, pharmacologists, medicinal and computational chemists, physicians, and many other team members whose single passion is to develop innovative medicines. So I developed, personally, I developed my science for medicine very early on in my life. I wouldn't even say my career because it was way before my career time. Well, I grew up in a very small town in Russia, in northern Siberia, above the Arctic Circle, in the town where we had one hospital. And my mom had a medical emergency one day, and she was truly saved by this female doctor. It was, and in Russia, there are many doctors are female, where something that I never really thought that would be a barrier. However, when you look at leadership roles, even in Russia, where the majority of physicians are female, those who head hospitals and governments are typically male. So this doctor saved my mom's life, and I definitely was inspired by her very early on. And I have decided to, and I was still in high school then, to volunteer there and to help out whichever way I could. And over the last 2 years of high school, while I was still in high school, I worked in this little local hospital and just helping out wherever I could. And then after high school, I started studying medicine, and then I transferred to an American college, the University of Pittsburgh in Pennsylvania. That is where I was exposed to research. And science and research what just caught my my attention and got under my skin, because that really fascinated me even more than medicine, because that is where the sky was really the limit, and we can research and discover who the unknown, basically. And so I started doing research fellowships. I think the University of Pittsburgh, the Honors College, was propelled me into the science love. And there were a number of mentors and amazing faculty with research fellowships that allowed me to spend summers working in the lab. And after my college, I continued on pursuing cancer biology research at the University of Cincinnati College of Medicine. And that is where I was, again, inspired and fascinated by other amazing women scientists that I worked together. And I will tell you a little bit more about those who inspired me further. I think it's the next question. And I do want to comment in addition to my early career, it's really being transported to this hub of biotechnology and innovation here in Cambridge and Boston when I followed my postdoctoral training at the Dana-Farber Harvard Cancer Institute at Harvard Medical School Fellowship for medical and molecular oncology and breast cancer group. I truly was exposed to this world where I can combine my passion for science and clinical medicine in developing medicines for cancer patients. And that is where I started being involved and got my first exposure to groups such as West and other professional groups in the area, without whom, honestly, it would have been very difficult, if not impossible, to break into the industry or the biomedical industry out of an truly academic path that I was on to follow on. So West had truly propelled me to my first industry job after my postdoc. And now I am serving on the board of West, and we are developing even mentorship programs, which I can touch on a little bit more, really giving back to the community and the importance of for us to support each other as women as we grow in our career.
Wow. Yeah, I would love to hear more about West in the follow-on question. And before we go there, I wanted to hear from Susan. Susan, you have made just a humongous difference in the genomics industry, being Chief Product Officer at Illumina. And I know that you also have a very strong voice in empowering more women and girls in STEM. I would love to hear from you for just a quick moment about your history and how you became that strong leadership voice in the market.
Well, thank you so much, Cassandra, for giving me the opportunity. And it's such a pleasure to have this forum to tell a little bit about my story and about Illumina and about empowerment of women and minorities in these important roles. My background is as an engineer. You know, I kind of grew up wanting to create things that would change the world, you know, to create technologies that couldn't even be conceived of today and products that would change how people do things, make their lives better. I was always with that technology focus to my experience. But I come from a long line of medical professionals. My father was a practicing physician. It turns out two of my older children want to be practicing physicians as well. So I always had it in my heart that I wanted to come back and do something, apply kind of what I do best to making a difference in medicine and human health. And so when the opportunity came up at Illumina, after working many years in high tech and creating, incredible products that were high tech and changed the world of, how people connected and created images and communicated, I saw the opportunity to bring that product experience to Illumina. And Illumina was setting out on changing the world based on making genomics accessible and as a source of information for, personalized medicine. And at Illumina, I've had the opportunity to take all of this amazing technology and put it together in a way that it could be accessible as easy as it is to share on social media or on Twitter, or to take a picture on a digital camera, or, that is the vision that we have. And we've made an incredible dent in that in the past 8 years I've been in Illumina.
Thank you so much. Now, for the hundreds of fellow leaders that are listening in today, would like to ask each of you, how can we use our voice, our influence, our leadership to really showcase and recognize more women and minorities in science or in our industry in general. Nicole, Elena, Susan, whoever would like to start, and we'll just popcorn around. Thank you.
I might just take a moment to share my screen for just a moment. If you can see this, okay. So I'm sitting, as a patient advocate, with the goals that we set forward are how can we equip individuals and other women to be able to, be prepared and, like I said, equipped to come and sit at the table and be a participant with our biopharma partners. And different from, kind of sitting on the other side where we're hiring individuals to come and kind of serve in the science and technology realm. What we're trying to do is ensure that patients and moms and individuals have the knowledge and the insights and access to the resources that can help them feel more comfortable and confident sitting at the table. Having the conversations with people like Elena and others in the biotech sector. So, the end game for all of us is, there's several different types of individuals that we are working to try and support so that we together, Elena had mentioned earlier about all of the individuals that it takes to kind of really bring an effort forward, all the different groups within Novartis, within the drug development sector. What we're doing is really showing that one of those areas or one of those key participants or stakeholders should be patients. And in order for patient advocates to sit at the table, and again, 85% of those are women, many of them don't have STEM education or formal education around running businesses. We have to do the job of helping support them so that they can sit with you, Elena, and provide feedback and be equipped to bring forward data, bring forward, efforts that they've started in drug development, et cetera. So what this diagram really shows is that the role of patients have moved from, love and hugs and kind of managing, although this still happens, your kind of personal family life situation, right? What happens 24 hours a day. But what we have tried to do and know it needs to happen in rare disease, especially in rare disease, is that we have to help support patients in helping architect not only like the health of their individual families and the health of their home, but also they have to be leaders and drivers in organizing and helping support their community, whether it's standing up not-for-profits, whether it's creating outreach, whether it's being that front door to clinicians so that they can better understand the disease, because patients and these moms have to become, the experts by default. They also have to then understand the business side, the science side of things, policy, legislation, et cetera. I mean, there's so much that goes into the world of these mothers and fathers, but these patient advocates, to be able to help drive efforts in their disease. And what we've seen is moving from just, living with the condition and becoming architect for your community is what's evolved even over the last 4 or 5 years is this notion of patients as partners and drivers of research. And again, going back to, 85% of the people that we serve are women, are mothers. How can we ensure that they have what it takes to sit at the table with extraordinary individuals like Elena, who are driving a lot of these efforts. And so we have had to do a lot around education, and then providing with RareX, like the tools and resources around data collection that help kind of support those individuals in total to go be able to sit at the table and be part of that vibrant ecosystem that's developing to drive treatments, therapies, and cures for the diseases that they care about. So in general, from a woman and a women supporting women perspective, we built organizations that reflect, the constituencies that we serve. And we're also ensuring that we're building out the tools and resources to support those that, are driving so much of what's happening from a patient advocacy perspective. The initiative that now I'm leading with Rare X is really around kind of, reimagining data collection and also data sharing. And with that comes a lot of interaction with the technology sector. Our technology partner in this is the Broad Institute of Harvard and MIT. And I can tell you that of the group of individuals that we're working with at the Broad, 75% of those that we're working with are women in science, on the technology side, and it is pretty extraordinary. I would say on the efforts that are happening within the biopharma space, I think what is extraordinary is that there's real intention with organizations like Novartis and others, Illumina, that are putting a lot of attention to not only women, but other, becoming inclusive in everything that they're doing. We at Rare X are also thinking about, as we build out these data collection and data sharing platforms, what we're thinking about is, inclusiveness that, isn't just about race or economics, but it's also about literacy and language and adaptive technologies. Because what we believe is that, we have to lead and do a better job ensuring that we can help support all comers. Whether you're a female, a parent, a mom, whether you're someone in a region that might not have access to computers, but know the importance of participating in trials. We have to make sure that we can be speaking at a level that is inclusive of everyone. We have to ensure that the technology that we're integrating can support everyone, whether you have hearing or vision impairment. So I think from on so many levels, we have to lead and become really intentional and passionate about ensuring that we remove barriers to access, to activation, to engagement, so that in our world of drug development and life sciences, that we can really represent the ecosystem. And we keep mentioning, by default, rare disease in our world is really so much on the patient advocacy side of the house, is really being driven by women and patients, patient advocates that, are a high percentage are women. And so we just have to make sure that we can continue to be mindful about how to support that in everything that we do.
This is the topic I think is really, really near and dear to my heart, in increasing helping to find the voice and to help visibility of women and other groups, and really across different levels. And definitely, I think only about several decades ago or so, right? So then when women were entering the science fields, it was fairly novel, right? So there were a few women who graduated, or those even Rosalind Franklin, obviously, one of these prime examples and role models. But I think even though today the great strides have been made and young women and girls are entering fields of sciences and almost at the same or even higher levels, and numbers are being graduated from colleges with science degrees, right? So, but what we are seeing, and that there are still when women are ready to make this critical pivoting in the career, that's when women do drop off, right? So, and those who are amazing, they're not finding the voice on speaking up and being heard. And that happens especially visible in the corporate rooms, right? So in the corporate environment, even more so in the academia, from what I've experienced. So, and obviously it's still very, very important for all of us to work on increasing this visibility. So what can we do to change this? I think one of the initiatives, and we also have done this at West, and other organizations are working on this is to ensure that women are equally represented at high stake conferences and speaking engagements, at really showcasing their talent and leadership. Often, especially when it comes to biopharma and business deals, in particular in VC world, as Nicole mentioned, right? So it's very even as recent as last year, it's not uncommon to have an all male panel of expert panel on a particular topic, right? So
an all white male panel.
yes, that is right. And certainly, I mean, there is nothing against the expertise, and many of my mentors, are men who's been instrumental in my career and very, very supportive. However, it is very important still to continue increasing this diversity. And one initiative that you may already know about is Nicole as well. So this initiative that MassBio pledged as part of their diversity and inclusion initiative, such as no more all male panels. I just love this, right? So and MassBio is an incredible nonprofit local organization of a high power and advocacy nonprofit group that promotes life sciences in the area and beyond. So this really was a clear message, I think, to the biotech community, and no more all male panels. And they really did stick to the to the words, and there are no more all male panels, which is incredible. Also, the same what we do at West, we host a number of events with high visibility and leadership women who all female panels, often but not exclusively, and which we find it provides a really safe environment for those who are still junior in the careers to ask all questions that they may not be comfortable to ask a male panel representative. So I think those are the initiatives that we can start doing, and we are doing right now as a part of West, and corporate initiatives to increase visibility and participation of women on expert panels. We can also do definitely much better in advancing women to serve on corporate boards and leadership roles. And that is the initiative that is definitely picking up pace throughout the country, and especially in European countries, where I think they are leading by example, where it's already required that women do comprise. I think it's I'm not going to cite the percentage, but all boards now are required to have a woman on the corporate board. So I think it's another important aspect, I think, that we can also immediately address is as mentors, right? Our everyday mentors. It's important for us to highlight and to ensure that as women, we don't act as facilitators only in various discussions, especially at corporate rooms and at business meetings. We often do tend to serve as facilitators, but we got to start saying that's what we stand for, and not just facilitate and find the common ground, which is incredibly important, as I do this every day in my day job, managing very complex alliances across the biotech and pharma spectrum. So, however, it is very important to have your own voice. And I think the third aspect is also equally important, is to promote and to keep building mentorship programs, both at within a company, across organizations, and completely outside of organizations. And just very recently at West, we are just rolling out, as only just a couple of weeks ago, we started rolling out our new mentorship program, which is kind of like almost like speed mentoring program, where we have a dynamic pod mentor groups, which allows for small group network and really close discussions and intimate discussions and networking. And just also to add, I wanted to add this, the importance, I think it's really important for at all stages of our careers, obviously, but I have a teenage daughter and who's been, exposed to all kinds of amazing science things. Like she was in my lab when I was doing science experiments, when she was in my baby Bjorn, and when she was a toddler and older. So I mean, she's the one who really seen science very early on and loves science to this day and continues to study it. However, I did see this switch when she was a very fearless 6-year-old who turned into a very self-conscious 16-year-old. And that's something that I did not expect as someone who's an advocate for women in science, who is very outspoken, and my daughter, of all people, would certainly be subject to this self-consciousness and loss, not so much of a loss of confidence, but not enough confidence to really believe it in herself. So having also resources and focus on girls in science and having and catching them right before they lose this passion for science, because all elementary kids and girls love science. And we did DNA extraction experiments at elementary school. Everybody loved it. Everybody was on board. Nobody was embarrassed. Middle school, not so, and freshman high school, really not so. So it's something changes there in that switch, being a 16, 17-year-old. And I do have to say that she's over this now. She's back into science. She's all going for it, and she did overcome. But I did have to support this consciously and work on this. But that is not something that most teenage girls have this. And there are organizations such as the Science Club for Girls that based here in Boston works exactly on this initiative. And I know that also at Novartis we have programs for high school kids to keep their engagement and exposure to sciences. So that's probably one, I think it's point number 4, I believe, if I lose track of supporting voices and helping finding voices for women.
Mm-hmm. Yeah, that's great. And leading by example, having you as a mom, I'm sure that your daughter is going to do just fine. And if we can put more programs out there like this one on mentorship and activities starting young, I mean, we see Illumina sponsoring the Festival of Science and Engineering down here in San Diego, and they attract all these kids to it. You walk around and you're seeing boys and girls learning what a sequencer is and learning about the different things that they can do scientifically and what they can look at. And it's really inspiring for the future of science in our world. So thank you for bringing that in and calling it out, Elena. And Susan, I know you have a very powerful voice when it comes to bringing more STEM activities to the youth and growing up being one of the few women in your class majoring in engineering. I mean, we'd love to hear your thoughts on how we can use our leadership to showcase and bring more of these women and minorities into our field.
Thank you for the question, Cassandra. I think it's incredibly important that we inspire women and minority representation into the field of genomics, into the future of medicine to make an impact. It was those experiences where I got to meet someone who was in a leadership position of what I dreamt to do that really made a difference in my pursuit and my belief that it could be possible to see myself in that role. I think about that in terms of leaders I had at my first jobs. I think about that in terms of people who came and spoke to me in college. And so whether it's, speaking at a science center, being on a panel for, students, actually going to a genomics festival and meeting some of those students, being in a, science competition where you're judging, and really inspiring that, you can be in a position where you're actually, making the decisions, even if you're not, widely represented in the field. For myself, I mean, we have great role models who are women in, just breaking the glass ceiling This is true of women who've recently won the Nobel Prize. Frances Arnold, who won the Nobel Prize in Chemistry, is on our board of directors, and she's an absolute inspiration to me. As is Jennifer Doudna, who uses our technology and is a collaborator with Illumina, recently won the Nobel Prize for her innovations around CRISPR. So we have role models emerging. The field is rich. Understanding the impact that genomics, the new modalities of molecular testing, molecular diagnostics, the amount of data that we're generating and driving insights from that data. We've made a lot of progress, but there is so much more to come. And we need to bring out the best of all of our people. And we cannot afford to not have women and minority representation. Their intellect, their passion, their drive. I see them as the future leaders. I see them in making a difference, and anything I can do to help inspire that is really at the core of what interests me.
That's great. We really need that holistic, everybody's voice being there, being heard. I love that you called out just how important it is to demonstrate that even if it may seem you don't look like the person typically making the decisions, that you really can be that person. And I think you're a strong role model for other children and students and young women who are entering into this field, being in your role that you're in. So thank you for being that and who you are. So now I'd like to ask a question that we are putting in front of all the 30 speakers at this event. We would love for you to provide 1 or 2 recommendations for the administration in Washington. How can we resurrect the importance of science and the support of more women and underrepresented minorities in this critical work?
I believe that there's been a tremendous shift and an emphasis put on the underrepresented and gender equality, and especially in STEM. And I feel like, or the hope is that will continue forward. There's been many different nonprofits, STEM and education efforts that, especially because of COVID, need continued funding. And so if the administration could, continue forward and continue to carve out funding support, and recognizing that there's a lot of grassroots organizations that are kind of in the trenches, helping support these individuals. We can't have that end. And so the idea, or I guess what I would suggest is, can we please, continue forward and continue creating and putting more dollars towards these grassroots initiatives that are helping support these individuals as we move forward. And then on the underrepresented side, I think much like with RareX, there's a lot of really intentional efforts out there that are emerging, that are looking to not only help support from an education perspective, but actually build tools and resources and platforms, and that have trusted relationships within the underserved communities. And we have to really, I think, be mindful about how to engage with those, again, that are in the grassroots. I think, it's easy to kind of go from a grass top or a high level perspective, looking across where, big, massive programs are coming into play and they can be funded. But I think the hard work is really being done in the grassroots or the grass tops. And so hopefully the administration can find a way to adequately support those organizations that are kind of in the trenches.
Thank you. Elena?
Mm-hmm. Sure. I think this too are such an important question. So if I can address maybe the second question first, on how to support women in science and to support their representation, especially when it comes to government efforts. And it would be incredibly important, and I would plea to the administration to continue supporting early education centers and early development for the kids, because especially now at time of COVID, we are seeing that majority of a weight is still taken by women, and in the absence of daycare, how careers are suffering. So additional support for daycare, for family leave and equal family leave, if there's additional support or encouragement or incentives for corporations to provide paternity and maternity leave equally. That would be my number one request. And I think secondly, in respect to resurrecting the science and for the future, continuing support of the NIH. I think the NIH funding is always critical, even though basic sciences does not bring drugs to the patient. However, all of the basic science discovery is critical for further discovery and development of life-saving medicines. If there is no NIH funding, I think there will be very difficult to provide grants to investigators such as Karen and myself when we were just kicking off our labs. So that is number two request, and I hope this will be heard.
Thank you. And Susan, would love to hear you next.
Well, I think there's no time like the present, and coming out of this pandemic, hopefully coming out of this pandemic, the fact that, science is really leading the way, the fact that we have vaccines faster than would have ever been done before, the fact that this, decades fight with cancer is finally, it really is reaching a, turning point in our understanding. And this is because of, our understanding of science, our understanding of biology, our understanding the genetic origins of disease. And these are the things that are going to improve public health, improve society, improve our resilience. So there's been no time like the present to really appreciate what science can do for us as a society. And that science, science is the exploration of, curious people, and is really trying to understand what is the foundation of kind of biology. I mean, what is the history of humankind and life form in general? And so bringing out curiosity, in my opinion, diversity is absolutely core to really kind of going after that curiosity, learning from one another, bringing new perspectives to the table. Every the team that I've had that has a diverse demonstration in terms of the leadership of the team, in terms of the scientists and engineers involved, always comes up with a better result. They always kind of break the barriers of it can't be done, or what's important to do, or how to prioritize, or because you have all voices at the table and you have a really rich perspective. And so I would love to put our best in front of our leaders, our political leaders in DC, and tell these stories. And I like I say, I think like now is the time, because everyone is just realizing the impact that science and technology and progress is going to have for a better future.
Wow. So now last question here, asking each one of you, and I know, Elena, you started on this topic talking about that extraordinary medical doctor in Russia who helped your mother. I'm not sure if that was that moment, but we would love to just hear for a few moments when it was, or what it was, or who it was in your life that really contributed to being successful, or even choosing to take the route you took as a leader in STEM or in science.
Yeah. Oh, thank you so much for this question, Cassandra. And that is, I think this is the question I do think a lot about, right? So that is the, I often, you go through life and you meet incredible mentors and supporters and those who really help you along. And so my most significant role model is my graduate mentor, and it's Karen Knudsen, who was my graduate mentor when I was working on my doctorate program at the University of Cincinnati College of Medicine. And Karen, right now, she's the director of Kimmel Cancer Center in Philadelphia. And she was my graduate mentor when she was the young investigator. She did not have another graduate student. She and I were the two of us in her lab. And and I was inspired by her fearlessness, by her passion, by her believe in me, who just showed up in her lab saying like, I want to work on something amazing, in something that has to do with cancer and the environment and women's health and endocrinology, and something amazing. And she believed in me. She's like, yes, we have a program that you can develop, and we will get the grant and we'll run with it. And we built the lab from the ground up. And now she has the cancer center in Philadelphia, and she and I have been in touch, for all these years. So I think people like Karen are really incredibly inspiring and enabling for those of us who are just starting, and but also importance of helping each other and feeding off each other's energy and ideas, and just being fearless and going for what you are passionate for.
Thank you. And Susan, would love to hear you next.
Well, I have to say that, I can't point to one or two people, but I think about the many people who along the way gave me that inspiration and that confidence to pursue something that, I didn't initially see myself doing. I didn't even know what an engineer did until I had a math teacher in high school say, well, have you ever considered engineering? You're really good in math. You're one of the best students I have. Have you ever considered pursuing, engineering? And I thought, well, my vision was you wear like a hard hat or you wear like overalls and, you're conducting a train. And he told me that, engineers work with things we can't even imagine today, and they're going to change the future. And it's going to be based on technology that we can't even conceive of. And the ability to actually believe that I could do that came from my parents, who always, kind of told me that I could achieve anything that I wanted to, that there's no barrier to what impact I can make in the world. And then just all along the way, I think about a leader that I had although, my first job at HP, our R&D team didn't have much representation of women. The leader of R&D was a woman. And I think just a few months into the job, she took me aside and said, I think you're going to lead this company someday. And I thought, I had no idea she even knew who I was. But she pointed out, you're confident, you're technically sound, you're articulate, you work well with people. I can really see you being a leader here. And I just thought, boy, I don't know if she had all the information to make that judgment, but her taking the time to just tell me that, it made all the difference to me. And so I think about that all the time, like, who can I impact? And so, I've been so fortunate to have people along the way who, kind of gave me that confidence and inspiration to pursue what I think has been a really amazing, career, and not so much amazing from kind of what I've achieved. I think everybody achieves incredible things the people I work with, but just in terms of inspiration to me and feeling good about the impact that I can make. And I would recommend that whatever you do in life, you think about what makes you happy, what makes you jump out of bed in the morning and approach every day like you can make a difference.
Thank you. Thank you so much for that. Nicole?
Yes. So in rare disease, we always say, what's your why, right? What's your why? And my why is my little friend, my little pseudo nephew, Derek Seymour, who was born into this world with all sorts of complications, and just had extraordinary parents and an incredible mom who went above and beyond to help find a diagnosis after 4 years and literally pick up and move the family to go be in a better place to help ensure that their son got the best care and support that he could. That's my why. my inspiration, I would actually say, um, and I want to, before I say this, I know that we're talking about women, women who inspire us, and I'm inspired by every single mom that is tackling rare disease on so many levels. But what I also don't want to forget are those men that saw you as an equal and encouraged you to break down some of those barriers that society has put forward, and that encouraged you when no one else would, to go out there and make a difference. And so there were three gentlemen that to this day, one of them passed, have made such an extraordinary impact on me, impact on rare disease, and have always been encouraging women, and not just me, but others, to lead, to grow. And that would be John Crowley from Amicus, who is a rare dad with two extraordinary kids. One of them just graduated from Notre Dame with Pompe disease. Henry Tremere, who passed and who was the former CEO of Genzyme, who from day one would spend time to encourage, tell me what was good, the bad, the ugly, make connections, introduce me to other women, but never ever doubted the passion. And I want to reflect back. I think one of the things that women bring to this is just an extraordinary passion for what we're all striving to do. And I think, you know, the men that have the confidence to say, you go, girl, you go, and we're going to support you is amazing. And the last but not least is Brad Margus, also a 3-time biotech CEO and a parent advocate of 2 of his 4 kids with ataxia telangiectasia. So I also want to thank those men out there that were willing to recognize the strength, the importance of women in this ecosystem in the life sciences, because they've given us the space to thrive and shine and to come forward and tackle some of the biggest challenges. And so I have one more, and her name, who Elena, you may know, is Dr. Christina Waters. And from day one, we had a shared vision of how we could tackle some of the biggest challenges in rare disease, looking across disease research, or looking across diseases for research, basket trial studies. And this was, 15 years ago, we sat and had these brainstorm sessions. And so she's someone on the science side who just was someone that we had shared vision and passion to really kind of game change, what was the status quo. And she spent a long time at Novartis, actually, on the cancer side. So I feel very fortunate that I've had mentors on the, my why, who inspired me to leave everything that I had intended on doing to jump into the world and help champion rare disease, to my extraordinary friend in research who had shared passions, to those men who never ever saw a glass ceiling and always supported women in growing and evolving personally, professionally, and allowing us to emerge as leaders and have a shared seat at the table.
Wow, thank you. Thank you for sharing all those amazing names of people who really impacted your life and bringing you to where you are and understanding your why. I really appreciate that, and think it was a really good testament of what it means to believe in others and really mentor and uplift them, to give them a powerful platform to become leaders themselves or to become enabled and empowered. So thank you for that. So let's wrap up today's conversation. I appreciate and thank every single one of you incredible women for joining us today. Thank you, Nicole, Elena, and Susan. Please stay with us. We have an amazing topic coming up next, from PhD to CEO. Thank you, everyone.